got a few PowerPoint slides left of respiratory. I appreciate your patience of me getting to this. All right, so we are in acute respiratory distress syndrome. It's ARDS for short. Basically what's happening here, it's a pretty severe lung condition, very acute. It can actually be fatal if not treated quickly. So basically what's happening here is that someone is brought in for a different reason. So someone's brought in from severe trauma, maybe they were in a car accident, or they're going into shock or whatever, what have you. And because of that other condition, like let's just go with shock, for example, and we haven't gotten to shock yet because we haven't gotten to the cardiac chapter, but in shock, basically you have vascular collapse, which is, when I say vascular, I mean like the veins and the arteries, the blood vessels, they're just not responding and functioning the way they're supposed to. So a bunch of fluid is actually rushing inside the lungs, which is generally not where we want fluid to be, because that's called drowning. So it's kind of like drowning inside your lungs. Instead of you breathing in water, the water is coming from inside your body and going into your lungs. I'll show you a little picture so you can kind of visualize what I'm talking about. So these are like the blood vessels, right? So we're just pretending like in shock, vascular collapse occurs and the fluid goes where it's not supposed to. So the fluid's coming out of the blood vessels and rushing into the alveoli. And obviously we don't want fluid in the alveoli, you know, the little grape-like clusters at the end of the bronchioles. We want air. So it makes it very, very difficult to breathe. So it's like you're drowning from the inside. The alveoli can collapse because of that fluid, prevents oxygen exchange. Very bad. Symptoms of this, so we have hypercapnia and hypoxemia. So hyper, we know, means too much. Capnia actually refers to carbon dioxide, so your carbon dioxide levels are going to be elevated, hypercapnia. Hypoxemia, hypo means too little. Ox is referring to oxygen, and emia is in the bloodstream, so too little amounts of oxygen in the bloodstream, obviously because oxygen can't travel in the alveoli when the water is there. Now, acidosis it's referencing the pH scale. I don't know if you're familiar with the pH scale. It's referencing how acidic or how alkaline or basic. Alkaline and basic are the same thing. It's just like measuring, you've probably seen the pH scale. It's a 1 to 14 scale. And there's like obviously a certain number you want to be at to maintain homeostasis, or to like be in a good, zone for your body. When you have too much carbon dioxide and too little oxygen, that puts your body into what's called acidosis. And that's just where your pH scale is all messed up. And that will show up on like an ABG or an arterial blood gas. So when someone takes your blood and analyzes it, they can see how much oxygen, how much carbon dioxide is in your bloodstream at the time, and see that someone is in acidosis. Dyspnea, we know, is difficulty breathing, and obviously because they can't breathe, they're going to have cyanosis, which is when their skin turns blue, mottled skin. Diagnostic wise, I mean, obviously I talked about the ABGs. They could do imaging when they'll see that fluid in the lungs. And again, this is something that's very acute, something that can be fatal. So we're going to be giving them supportive care, definitely putting them on oxygen, maybe a ventilator to help breathe for them, various medications to help keep them stable until they can resolve that. So again, here's that picture of what it looks like. And we're almost done. We're going to go ahead and do lung cancer. Lung cancer, cause of this is actually one of the most common causes of death worldwide, one of the most common types of cancer. There are two types of lung cancer. There are small cell, which is the SCLC, small cell lung cancer, and the non-small cell lung cancer, the NSCLC. Now, the two types, for the small cell, is mostly seen in smokers. That doesn't mean that it's always, so that's important not to like assume or judge, but it is almost exclusively seen in smokers. And then the type of cancer that's more common in people that maybe have just had exposure to irritants or like maybe mold or chemicals in factories is the non-small cell lung cancer. And smoking is what contributes to about 90% of all different lung cancers. All right, so symptoms of lung cancer. Cough is the big one. So people just keep coughing and coughing. Most of the time this is because there's some kind of tumor or growth growing in their lungs, and your lungs can feel that. It's like this irritating feeling. You know how when you have like sinus drip kind of dripping down your throat, the sensation of that kind of tickles your throat, makes you want to cough. Well, it's kind of imagined the same way with having a growth or a tumor lodged in your lungs where it shouldn't be. It's like this constant feeling of irritation making you want to trying to cough it out, like subconsciously you're trying to cough it out. With or without sputum production. Sputum is just, like the phlegm, the mucus, so you can or cannot have that. Dyspnea, again, difficulty breathing, and that's, again, because a tumor growth is going to be blocking your airway, right? So it can be difficult to get air through the bronchi if there's a tumor growth blocking that. Now, hemoptysis. Now, heme, we know means blood, and ptis is referencing cough. So bloody cough is the medical term for hemoptysis. Let's see. Chest pain. The pain is going to be more dull rather than sharp. Sharp pain would be more like if you have what we talk about, pleuritis, where that inflammation of the membrane around the lungs. It's going to be dull, coming and going, intermittent. Lung cancer diagnostics is done with x-ray. They can see that growth inside of the lungs there. Tissue biopsy, so if they do find a growth, they'll want to biopsy it, and again, a biopsy is where they stick a needle and then suck out a couple of those cells, analyze them under the microscope to see if they're malignant or if they're benign. Because sometimes we have benign tumors, but generally it's going to be found as malignant. And then the staging is based on the TNM stage, so tumor nodes metastasis, that's TNM. Tumor size, N's for node involvement, so if there's nearby lymph nodes that are affected, that's going to be more difficult than if they aren't. And M for metastases, and that kind of gives you whether it's stage 1 through 4, 1 being easier to treat and 4 being more difficult. And treatment-wise, obviously surgery to remove those tumors, chemotherapy and radiation. Most people already know about those for cancer treatments. Let's see. All right, and that is kind of just a little picture of what different locations of tumors can do in the lungs. All right, and that about wraps it up for the conditions. Oh, here's a picture of smoker's lung. Another reason not to smoke, in case you didn't know already. Let's talk about some of those medications from earlier on in the PowerPoint from part 1 that we did. So TB, this is back to tuberculosis medications. So when you treat tuberculosis, it's actually a very long treatment. It's not something simple you can just give and take for a week. It's usually a 6 to 9 month treatment with a very specific antibiotic recipe. You can remember the acronym RIPE to remember it. RIPE is rifampin, isoniazid, pyrazinamide, and ethambutol. These together form a little cocktail for treating tuberculosis. All right, now inhalers. These are primarily used to treat asthma and COPD. And remember, asthma wasn't in the textbook, so we added a couple of YouTube videos to learn about that one. Asthma and COPD. So with asthma and COPD, the issue is that airway is obstructed, right? That's what the O in COPD stands for, chronic obstructive pulmonary disease. So bronchodilators, this is one kind of inhaler, are going to be used to open up the bronchi, right? Bronchodilators. Dilators means to open up so that more air can flow through the lungs and more oxygen exchange can occur, because it's really hard to breathe when your bronchi are constricted and like squeezed tight. Okay, so very common types of bronchodilators are albuterol, levalbuterol, salmeterol, and formoterol. You'll notice that they all end in terol or some kind of terol. Some of you may have asthma. It's pretty common. This is not an exhaustive list. This is just kind of the common ones. Brand names, Ventolin, ProAir. There's some Xopenex, Ceravent. So those are common for those. Then there is also a different class of medications that are also inhalers that are called inhaled corticosteroids, or ICS. What steroids do is they reduce inflammation, swelling, and help decrease the mucus production. Okay, and these ones, fluticasone, budesonide, mometasone, beclomethasone, and we've talked about steroids before. Notice they usually have zone in them somewhere. So fluticasone, budesonide, omeprazole, and beclomethasone. Okay, and brand names: Flovent, Pulmicort, Asmanex, Qvair, ReadyHealer. And this is what those may look like. And the medication is inside the inhaler, and you breathe them into your lungs so they can go directly to the source, rather than having to like be a pill form and go through the stomach, and all that would take too long. Inhalers are very rapid acting. All right, so let's talk about antipyretics. These are fever reducers. So anti means against, pyre, kind of like funeral pyre is referring to like fire. So it's like anti-fire. So it's like kind of like bringing your temperature down. Okay, these are very common. A lot of these are over the counters. You may be familiar with them already. Acetaminophen, very common. Tylenol, ibuprofen, Motrin, Advil, aspirin, naproxen, Aleve. All of these help to bring down fever. Cough meds. So there's two kinds, and I've been using these a lot this week. I've been sick. So there are expectorants and cough suppressants. So expectorants, these work by kind of making it easier to cough up the mucus and the phlegm in your airway. They thin the mucus, making it less kind of sticky, easier to cough up, turning a dry cough into a productive one. So when I say productive cough, I mean that you're actually producing, right? Producing phlegm or sputum that you're coughing up, which is actually good because you're getting it out of your lungs, right? And common meds for that, guaifenesin, you might see, when you go to Walmart or Walgreens, called Mucinex or Robitussin or Delsym. And then we have cough suppressants, which are helpful when you're trying to sleep, right? And you know how you have to keep coughing all night because you're laying down, so the sinus drip is worse. Cough suppressants will help you to sleep and not have to cough so much. So dextromethorphan, also known as Robitussin, and Mucinex. A lot of Mucinex and Robitussin have both at the same time, but you can get them individual as well. All right, and here's just, typical over-the-counter dextromethorphan combined with guaifenesin, Robitussin. Decongestants. All right, so these will decrease the swelling in your nose, right? When you're very congested in your nose and it's like you can't breathe because it's so swollen. These are often used for colds, flus, sinuses, allergies. So it doesn't really matter whether it's like, oh, I have a cold, a virus, bacteria, whatever. It's going to address the congestion. It's not going to be treating the illness itself, right? So this is kind of irregardless of whether it's viral, bacterial, allergy. Doesn't really matter. It's going to treat the congestion, not the actual. It's just the symptoms, not the actual cause. So common ones: Afrin, that's like a nasal spray. There's pseudoephedrine, which is often known as Sudafed, phenylephrine, Sudafed PE, and then the oxymetazoline. That's that Afrin nasal spray. All very helpful to help it be able to breathe. Okay, antihistamines. These are really good for allergies, right? So the most common one we know is Benadryl, diphenhydramine. A lot of people know, especially living where we do with there being tons of pollen. Seasonal allergies are crazy here. So diphenhydramine, Benadryl, cetirizine, Zyrtec, foxofenadine, Allegra, and loratadine, Claritin. Notice they all end in INE, to help you remember that. So all that like kind of wateriness, watery eyes, watery nose, that's from the histamines being released in the body. So antihistamines are going to help with that. And histamines are what are released during an allergic reaction. Okay, so an allergic response will cause that. So that's why you can get it with, like flowers, like pollen, all that kind of stuff, causes that histamine release. And then we have oseltamivir. We know that it is an antiviral because it ends with vir, V-I-R, for virus. Tamiflu, this is the brand name, and it's used to treat the flu. Specifically, I can't remember if it's influenza A or B, it doesn't matter, I guess. But generally it's given within like the first 48 hours of illness, or it won't really do anything. And it just kind of helps treat like the course of the illness, make it more bearable. It doesn't actually, we don't have a cure for viruses, right, like we do for bacteria. So it's just mostly symptomatic treatment. But let's see, I think that is the end of our 50 points PowerPoint slides. That brings us to the end of our respiratory chapter.